aim to accelerate the implementation of national responses to address NCDs and mental health conditions with a view to reduce premature mortality from non-communicable diseases NCDs by 1/3 and scale up interventions to reach SDG target 3.4 by 2030 by catalyzing action through partnerships and capacity building. A 4-day WHO global meeting on non-communicable diseases and mental health organized by the WHO with the support from the Minister of Health and the Gulf Health was held in Muscat. The event gathered representatives from over 100 member states of the World Health Organization across the globe from public health and other sectors.
I'm so glad to be here in this meeting hosted by the Sultanate of Oman. In fact, I'm impressed with the country, with the work that Sultan is doing, particularly on NCD. You had the opportunity today to visit the health centers facility, the primary care. I'm so impressed with the level of organization in this country.
I think it is very important for us to accelerate progress because when you look at it, NCDs do not wait for anybody and they are silent. And therefore, we ourselves have to look at what we can do fast enough before what we normally say the cost of inaction overtakes us. So this is a very important meeting, and I think program managers from around the world, from member states, have been equipped with quite some motivation and knowledge that they can use to have the right kind of passion, to pursue the right kind of skills, and do the right kind of strategic plannings and implementations.
Thank you very much for all the speakers and WHO for organizing, and Oman of course for organizing such interesting and informative meeting. Thank you very much. In terms of Oman, I just can say that I'm amazed by the natural beauty and the people of Oman.
I had a chance to present my fellow youth and explain how the youth are affected by NCD and what the youth can do to improve the health of other young populations across the world.
I am here representing Latin American civil society and a coalition of more than 300 organizations from Latin America that are all engaged in prevention and control of NCDs, chronic diseases. I am very thankful to the government of Oman for having hosted this meeting, and of course to the World Health Organization.
It was my pleasure to have an invitation from WHO EMRO to participate at this big event for the global NCD meeting, and was this time hosted by in Sultanate Oman. Thanks for Sultanate Oman and thanks for WHO.
So it was great to be here in Oman, Oman being one of the key countries with successes in NCDs prevention and treatment and control, but also to be a part of the World Heart Federation, as president of the African Heart Network. I think there's a lot of learnings that we will take back to our countries.
I'm the head of the mental health unit at the Palestinian Ministry of Health. And this conference has been very a precious opportunity to participate in this conference because it's a big gathering for important professionals from all over the world who meet together and put their efforts together to act to reduce non-communicable diseases and the burden of mental health problems on the people of the world, on their population's community and well-being. We've been treated very kindly and generously in this country. We are thankful for the people of Oman, for the government of Oman, and for all the professionals that we get to know here.
Throughout its 4 days, a series of exciting and interactive plenary and panel discussions were conducted, while numerous new initiatives to prevent and control NCDs were launched.